Medicine in 3 minutes, back here with another video, and today we're going to be talking about diabetes insipidus. We're going to keep the subject clear, brief, and illustrated, so let's get started. Now, when we're talking about diabetes insipidus, it's going to involve the pituitary gland. Now, the part of the pituitary gland that's going to involve is not the anterior pituitary ACTH. We're actually going to be dealing with the posterior pituitary ADH. As you can see, it's located right behind the nose at the bottom section of the brain, as you can see in this general location. So the ADH, antidiuretic hormone, is produced in the hypothalamus and is stored and released by the posterior pituitary gland. So that's what we're going to be dealing with when it comes to diabetes insipidus. Now, when we're dealing with diabetes insipidus, we spoke about how the anterior pituitary gland is not involved. Now let's find out why the posterior pituitary gland is involved. Now, the first thing we need to know is that the ADH does act as a control towards the kidney. It lets it know how much water to exert in the urine, and it acts as a stop. What happens is there's a lack of secretion of this hormone, the antidiuretic hormone called ADH, and when there's a lack of this hormone, there's actually going to be an excess in urine that comes out. So, in other words, if for some reason the disease does appear, the secretion or response to the pituitary hormone vasopressin is actually going to be impaired, which, like we talked about, is going to result in the production of a very large quantity of diluted urine, and which often is going to lead to dehydration or like an unquenchable thirst. Okay, now when we're looking at causes,